Ergonomics is a study of the relationship between workers and their environment, products, and services. However, we won't talk about services in this video. To improve a worker's environment, you need to increase their psychological well-being. To improve their products, you want to reduce the risk of injuries. First, we will talk about physical injuries and why they occur. Then we will move on to psychological issues and their causes.
Work-related musculoskeletal disorders fall into the category of ergonomic injuries. Musculoskeletal disorders are the leading cause of missed workdays and restricted workdays. A restricted workday means that the employee is present at work but not capable of performing all the regular functions of their job. According to the Bureau of Labor Statistics, in 2011, the top 5 occupations with musculoskeletal disorders contained 2 occupations within the health industry: nursing assistants and registered nurses. A 5-year study published in 2001 set out to determine the effects of implementing an ergonomic program within a hospital. To conduct statistical analysis, a similar hospital was used as a control. The ergonomic program was implemented through training and assistive devices. Staff members helped identify the most stressful patient handling tasks. These tasks were transferring patients in and out of bed and on and off of a stretcher, lifting patients up in bed, and toileting in bed. Data was collected during this experiment on an annual basis. The data collected consisted of number of back and shoulder injuries and number of lost and restricted workdays. For each task, the perceived exertion to back and shoulder and patient comfort and security ratings were recorded. The mean difference between the control and experimental hospital was statistically significant for all of the handling tasks listed on the previous page. At the end of the study, it was found that implementing an ergonomic program lowered the perceived physical stress of the workers, raised patient comfort and security, and lowered number of injuries as well as lost and restricted workdays.
The first factor affecting healthcare provider injury involves patient cooperation. One article notes that patients sometimes do not feel comfortable with medical equipment because they are not familiar with it. The article also notes that some healthcare providers will not end up using the equipment designed to help with patient lifts because they do not want to sacrifice patient satisfaction. The article continues to note that it is more important that the healthcare provider is clear in communicating the need of the equipment because of safety and health of the patient and the worker. Healthcare providers also experience injury by putting their needs behind the patient's. NIOSH has calculated that 35 pounds is the maximum recommended weight healthcare providers should lift without assistance from equipment or the patient. Sadly, increased obesity in our society has made NIOSH's recommendations near impossible without the assistance of equipment. The American Nurse Association has taken note of this and has studied how implementing safe patient handling and mobility programs has decreased healthcare worker injuries by 95%.
The psychological factors are an important consideration when dealing with ergonomics in the healthcare industry. In one survey, nurses answered questions that related to their daily activity, pain coping and control, depression, and work life. Results of this study indicated that employees were more likely to report a work-related injury if they had a negative attitude towards the effect of their job, due to nursing being a very stressful and traumatic career. For example, 71% of nurses have reported being either threatened or attacked by patients and their companions in the workplace, which can obviously have a big effect on their psychological health. Additionally, 93% of nurses said that they are negatively impacted by their job in the form of depression, sleep disorders, nightmares, and high stress. Another interesting result of the study found that there is no significant relationship between workload and the number of injuries seen in the workplace. These results indicate that the psychological health of nurses should be considered in addition to the physical health, in ways such as counseling, better work environments, and improved rest cycles.
With the correct ergonomic training and equipment, healthcare workers have better attitudes about their job and fewer injuries. Ergonomists should raise awareness for these issues.